Thanks for joining us for Module 4 of the Resilience and Assertiveness Program for Dupuytren's patients. I'm Eleanor Shakiba, a trainer and coach who uses positive psychology to help people thrive. The question of trust is a very important question for anyone who's making treatment decisions. After all, you literally are putting your life and health in the hands of your providers sometimes. But it surprises me how very often patients hesitate to voice their concerns about trust. As an assertiveness trainer, I believe that you have the right to ask questions and to seek a second opinion and to share with your care providers your fears and concerns and be taken seriously about those. That's why I decided to include this video in our series. My aim is to help you communicate assertively with your treatment specialists so that you can truly build a relationship of trust. So let's look at what this involves. Research has shown that there are two key components to feeling that you can trust a professional advisor. The first essential ingredient is pretty obvious, it's competence. The second ingredient is less obvious, it's connection, or the ability to connect with patients in the case of a doctor. Let's have a look at each of these one by one. Obviously, competence relates to whether or not you have a specialist with appropriate qualifications and experience. But when you're dealing with a condition like Dupuytren's, there's a second level that you really need to be aware of, and that's that your specialist actually has expertise in this specific condition. You might also want to think about their track record and results and ask questions about that. And you might want to think about how well does your specialist answer your questions, specifically thinking about whether or not they are able to translate jargon and concepts into language that you understand. All of these are baseline elements of technical competence. But now let's think about the other half of the equation. A truly great specialist is going to work with you and establish rapport. This means that they have to have high-level communication and connection skills. What are we looking for here? Well, firstly, they're going to ask about the whole you. So, for example, I remember one surgeon starting the conversation by asking about my hobbies rather than going straight into what my symptoms were. Another thing that you want to look for is that the specialist informs and consults you, so they don't just tell you what to do, but they're treating you as an equal partner in managing your condition. Thirdly, they listen to you and they do that respectfully, and this is actually one of the core competencies of anyone who's an expert in their field. The next thing is looking out for whether the specialist truly takes your concerns seriously. So you should feel comfortable asking any sort of question without feeling foolish. And finally, do they adapt their style to you? One of the things I like to do is watch a doctor as they're in their waiting room and notice whether or not they change the way that they speak to patients depending on the person that's standing in front of them.
You know, don't get that white coat syndrome. Just, you're the patient. Trust your instincts. Go with what you think is best for you, because then you'll get the best outcomes. If you're sort of pushed into doing something that you're really not sure about, then you're not going to get the best outcomes at all. It's got to be right for you. It's your hand or your foot. And I think you have to do what's right for you, definitely.
Deb's advice is well worth taking. What she highlights is that you can't have a trusting relationship in any context, including with your doctors, without feeling free to express the real you. That's the you that has feelings, that it has worries, has basic questions, not stupid questions. So learning how to express the real you and to be okay in communicating it means learning to speak up assertively. There are 3 main rules of assertiveness that will help you to do this when you're talking about your Dupuytrens. Firstly, being assertive means being in touch enough with yourself to truly know what it is that you need, both emotionally and in practical terms. For example, practical needs can relate to things like gathering information, but they can also relate to elements such as managing your time and fitting your treatment process into a manageable schedule. Emotional needs are a little bit less easy to pin down, and they will often be around the support you need and helping you to manage your fears or concerns. Let's have a look at a few practical needs that you might want to consider discussing when you're thinking about treatment options, for example. And here are some examples of things you might think about in relation to your emotional needs.
Be an educated consumer. Ask uncomfortable questions. Where did you do your hand surgery fellowship? What will you do if my finger has no circulation at the end of your procedure? What if you straighten my finger and my contracture comes back and is much worse than I started?
There were some great examples of assertive questions there, and this is the second principle you need to keep in mind. Being assertive means asking for information when you need it. Here's a few more useful questions for you to consider asking. You'll notice all of these questions are clear, respectful, and focused on clarifying information.
To do as much research, and if you don't understand, ask. Don't sort of put it away, ask. I probably wish I'd asked a little bit more about this, but I think I went in all guns blazing, thinking, yeah, I'm going to be cured, I'm going to have nice straight fingers again. You know, that's all I could see was that treatment means back to normal, back to how you was. Yeah. It's not.
That last point is an interesting one because feelings can become heightened when you're talking about treatment options. Being assertive means being able to share your feelings and especially to share anxieties or fears. I was in my 40s before I learned the power of doing this, and I had my dentist phobia to thank for that. That phobia had been getting worse over time, and I was finding, even when I went to get my teeth cleaned, that I was really working myself into an anxious state for days before. So finally, in desperation, I said to my dentist, look, what can we do to manage my anxiety? This is getting really bad. And he just looked at me and said, well, we can give you gas. And I know that sounds slightly strange to anyone who doesn't have a dentist phobia, but it means now that I can actually go to my appointments without fear. This was a very powerful lesson. I had been scared of dentists my entire life and I'd never mentioned it. And there was a solution sitting there that I hadn't had access to. Well, I am so pleased that I learned that lesson before entering the world of hand surgery.
But I think you just have to ask for it. And I think a lot of people are very open to all of this, but you just have to put yourself out there and put a smile on and say, look, I'm struggling with this and this is how you can help me.
Deb's advice is a great starting point for anyone who wants to learn how to be more assertive in speaking up. Remember, You don't have to start from scratch in becoming an assertive patient. There are lots of places where you can get advice and assistance, and one of the best places is probably online support groups. You can also speak to a counsellor or a coach with expertise in assertiveness, or you can speak to your general practitioner or primary healthcare provider who might be able to give you some tips and suggestions. Regardless of where you are in your Dupuytren's journey, it's helpful to always remember that getting help starts with speaking up. So just do it.